Operation Eyesight, a joint effort between the Minnesota Eye Foundation and Minnesota Eye Consultants, addresses the urgent need of patients facing dire financial burdens, unemployment, bankruptcy, or lack of insurance or disability benefits. This charitable outreach provides treatment for those who cannot otherwise afford care. Surgeons and clinic professionals donate their time and skills to perform eye surgery at no cost to patients from the Twin Cities, Greater Minnesota, and Wisconsin. With support from local and national industry organizations, all resources are donated for Operation Eyesight, including anesthesia, medications, and the lens implants used for cataract surgery. Since its inception, the program has become an invaluable service for patients who would not otherwise receive this specialized care. It is a meaningful initiative where the physicians and staff of Minnesota Eye Consultants come together to give back to the community.
So approximately 10 years ago, I realized that there were quite a few patients who had needs for surgery and didn't have means to pay for it.
So Operation Eyesight is Minnesota Eye Consultants' free surgery program that provides surgery for folks that otherwise wouldn't be able to access care.
Cataract surgery, corneal transplants, and lens implants, glaucoma surgeries, for example. The Minnesota Eye Foundation also supports education. They also support research. They also support fellowship programs for both optometry and ophthalmology to try to help to further the goals of good health care for the eyes here in Minnesota.
Yeah, right toward the end when my eyesight was really going downhill, it was I did quite a bit of catering and making deliveries to places that I didn't know where they were. It was real tricky reading street signs and addresses. If I knew where I was going, I was fine.
My eye just was really bothering me. It seemed blurry and stuff, and I went to my family eye doctor, and he said that's what it was. And he was the one that recommended here.
The cataracts that I had is that they came on so gradually that you don't realize you have a problem, and you try to compensate and figure out other ways around it until you finally just get so frustrated and depressed that you don't know why, you know, that there's something wrong. And finally you start reaching, well, I finally reached out for some help, and I didn't know what to, actually didn't know where to turn. Actually didn't have any insurance. I didn't know what to do because it wasn't nothing I'd been exposed to.
Yo tenía 13 años cuando tuve mi accidente. Me operaron y después volví a tener otra operación porque me dio aire como al mes, cuando ya todo estaba supuestamente bien. Y desde entonces hasta ahora estaba así.
We have about 40 to 60 volunteers working on that throughout the year.
The lenses are donated. If we're doing any corneal transplants, the Lions Eye Bank has been great in donating tissue. I also work with different companies to get all of the food donated, so the breakfast, lunch, snacks throughout the day are all given to us as well. The interpreters are donating their time. So pretty much everybody just comes together throughout the day and is donating anything that they can to make the day a success.
I finally got tired with the way I was not able to see and didn't know where to turn, and I finally just got desperate, did a prayer and looked online and I found a Minnesota Eye Consultants.
Fui a la clínica a Minneapolis porque busqué quería buscar una parte, no le hace que me cobraran, en donde me curaran mi ojo, pero unos doctores que me atendieron dijeron que podía que me ayudaran en este programa, y les doy gracias a esos señores que me mandaron a lo que está pasando ahora. Estoy muy contento porque hice lo que tenía que hacer.
Well, you know, it's like anything else when you're up at 4:45 on Saturday morning, you're thinking, oh, it's Saturday morning. But by the time you get here and you start talking to the patients and hearing their stories and finding out how much this means to them, it's very reassuring that we're doing the right thing, and the patients are so grateful that by the end of the day, I think everybody has a really good feeling that we've done something to give back, and that we're not just here, you know, for other reasons. We're also giving back to our community.
My eye is clear, it's not blurry. It seems a lot clearer, not blurry like it was. It's just nice to be able to see again because it was getting harder and harder. Wouldn't happen if it wasn't for this program.
Well, of course, going into the surgery, I didn't know what to expect. You know, is it going to be robots? Is it going to be, you know, what is it? But the doctors are really nice and funny. And when I got in there for surgery, they made me feel really comfortable. There again, I didn't know what to expect. I do remember the surgery vaguely. It's like, it almost seems like a dream. But then, as soon as it was done, it was like, what? I could see the fuzz on my little towel that was on my chest. And it was like colors I hadn't seen for a while, and it was like, wow. And that was only one eye. And I was like, I walk around and, you know, this is great. One eye is good, I'm good. See you, thanks.
I am a bird watcher, and I had to give that up. It was getting things back that I had to give up. The moon at night looked like a brown smudge in the sky, and after I had my first eye done, it was probably within 48 hours that I saw the moon, and it was quite a shock to see, you know, because I could actually see features.
Porque es muy duro no mirar y siente uno mal. Por eso cambio mucho.